Good morning, good afternoon, good evening, everybody. My name is Professor Kyra Lee, Professor K for short, and I am sitting here with the K Stewart on KSF Live. Welcome, K Stewart. How you doing today?
I am doing amazing today. I'm feeling good on this beautiful rainy Monday in the Bay Area. How are you?
I am equally avoiding this rainy Monday in the Bay Area. For those of you all who think Cali is warm all the time, it is not. And we are definitely doing our best to stay warm and dry today. I want to jump right in because we are 4 days away from the first Pride and Purpose blood drive in the city of Richmond, California. And I have the honor today on KSF Live to interview Kay Stewart, who has become well known as a former athlete, safety and security advocate, and proud masculine mom. What people may not know about you, though, is that you also carry the sickle cell trait. How has knowing your sickle cell status impacted your journey along the way?
That is a really, really good question. um, because it has not impacted me up until I found out in 2019. That is when, so all of my years of living, I had no idea that I carried that trait. All the doctor's appointments I went to, all the blood testing, that was the first time. So I can definitely say right now in the present, it has changed the way I just think about life and how I have conversations with people that I love and care about and people who talk about families. Now I bring that into my, daily conversations with folks.
You have carried your 5-year-old daughter during COVID. She is a COVID baby.
Yes, she
How
is.
did testing become a part of your donor process and planned parenting journey along the way?
Yeah. So uh, the cool thing about planning for your child's arrival is really getting to, it's almost like creating your own shoe. You get to decide like how you want to go about it. And I wanted to start internally. I wanted to see me as the vessel, the person I'll be carrying this life. Am I okay? I remember my dad when I was younger, he would go on these road trips and he would always take the car to the shop to get a tune up. I'm like, why? Nothing's wrong. He was like, well, we're about to do this big trip. Let's make sure we can handle it. So I applied that to life and I wanted to get my blood tested. I wanted to test to see if there is anything I will be giving my child, anything that I should be concerned about, anything that's, high risk. And then it would lead me to whoever my donor would be, testing their blood and seeing what comes when we compare it all together. So, yeah, that's how it started.
Very cool. So, what were some of the things that you tested for? What were some of the things that you were on the lookout for prior to becoming pregnant and finally delivering?
I can't even tell you what exactly. I know that as humans, we carry a lot of things, a lot of good traits, a lot of not so good traits. We carry, recessive genes and we have, diseases out there. And I just wanted to test for everything. And that's what I told my doctor. I said, I just want to test my blood and see where I am, and what are the risks of reproducing with anyone. So I did not have a idea what I wanted to test for. I just went to test for every possible thing there is to test for. And you do have to ask and advocate for yourself because I went through majority of my life not knowing I was a sickle cell carrier, which means when I went in to ask a doctor to test my blood, I had to be clear, like test me for any type of diseases or disorders, anything. So yeah, that's how that process started.
We originally, while planning this blood drive, did not see a lot of participation. Folks were a little hesitant, getting tested, needles, the whole nine. How would you describe the culture of care surrounding, particularly being a Black mother, how it feels to be in medical situations currently? Do you feel cared for? Do you feel safe? Or do you think that we need some improvements in our medical systems?
I think we need some improvements in our medical systems, from someone who has been a patient to being someone giving care in hospital settings. I've been on both sides, and I think we got a lot of work to do, especially with Black women. Um, Starting with just listen to us. Just listen to us. If we say it hurts, it hurts. You know, that would be the number one. Being in the medical field as a Black woman, I don't always feel safe. I don't always feel cared for. I can I can have something truly wrong and be concerned about it. But my concern won't really be what I'm dealing with. It's actually how do I frame it to the doctor so they don't think I'm a drug addict, that I'm just trying to get a bunch of, Vicodin, something that doesn't get on my medical records that'll hurt me later. So I can't just go in to get care. I have to consider all these other things where I just want to deal with my issue. And I don't want to deal with any other stigmas, any other underlying racism, for me being a masculine presenting woman, sometimes I get bypassed of just the care of a woman when I'm in those settings. I am thankful I have a team of medical professionals that are all Black women. And currently, I do feel very cared for. I have people who represent me and care for me in good ways. And I had to go find them. And so I'm sticking with them.
I love that. So, for our younger parents and parents to be that are interested in starting their parenting journey, could you share some of the planning, some of the questions that you should be asking? More than falling in love, more than do we like each other, is everybody looking good and smelling good? What are some of the donor questions that folks might want to ask just to make sure that they keep themselves and their future children safe?
Medical history. Number one, what is your medical history? Physically, mentally, spiritually, how are you? Because when I found out I was a sickle cell carrier, that changed the entire donor process because it is, for me being a donor, looking for a donor who I wanted to be Black now becomes a little more challenging, because what we've seen is that often a lot of Black, people, Black Americans carry the sickle cell trait. So if I now reproduce with someone who is Black, I need to make sure that testing their blood is crucial, crucial. So that's what I would ask, because being in love is great, smelling good is great, looking good is great. But eventually you're going to want to reproduce and make little baby miniature versions of you. And don't you want to give them the best chance at life to be healthy? And it starts with conceiving.
I love that. Thank you so much for spending time with us today as we lead up to the Pride and Purpose kickoff, the first Pride and Purpose blood drive and sickle cell testing event
Yes.
that will take place in Richmond, California. We will be at 440 Civic Center Plaza in the basement room of Richmond City Hall. We'd like to thank Councilwoman Jamila Brown for being our resident host from City Council of Richmond. And we would like to thank the American Red Cross, particularly Ed Faso, for bringing all of the wonderful information, the specific sickle cell department and expertise and team that will be taking care of each and every donor that will be donating this Friday. We will also be giving out $20 Amazon gift cards
All
on behalf
right.
of the American Red Cross for everyone that does show up, does schedule your appointment in advance, and does complete your donation. Knowing your status is absolutely crucial. So I can't thank you, Kay Stewart, for shedding a mother's light on why it's so important to know your status. We could literally eradicate sickle cell traits and disease within the Black community in one generation if we simply make this a part of Black culture. Was there anything that you wanted to say to folks before we close out, Kay Stewart?
Thank you for having me, Professor K. I've enjoyed this. Thank you for giving me an opportunity to, share things that mean a lot to me. And I just want to acknowledge the city of Richmond for just always supporting me, the K Stewart Foundation. I want to thank TRK for the partnership, and Together We Rise Richmond. I really appreciate the partnership. And lastly, this is a big movement, but sometimes putting a face to the movement matters. So, a dear friend of mine, Damika, we went to high school together, and she has beautiful children. She's an amazing mother, and one of her children have sickle cell. And little Jaylani, adorable, intelligent, bright young little girl that needs some help. So people, these are our people, and they need our help. So I'm asking everyone to come out and donate, especially our Black people of color. Please come out and donate.
Absolutely. So we appreciate you all. We will see you on Friday, December 26th from 9 a.m. to 3 p.m. You can register to donate at www.kstewartfoundation.org. And you can also follow our journey at Instagram/K Stewart Foundation. That is STEWART Foundation on Instagram and Facebook. Thank you again, K Stewart. We are signing off from KSF Live, and we will see you all out there changing impacts and outcomes for our marginalized families in the community. Thank you so much.
Thank you.